So part of our clinic in the Health Hub, we offer STI testing for young people, for young men and women. Anyone who has sexual intercourse without a condom puts themselves at risk not only of pregnancy as a woman, but also at risk of sexually transmitted infections. We also offer the morning after pill for young women who have found themselves at risk of potential pregnancy if they've had used no condom or used a condom which has ripped or split. We offer that up to 5 days after unprotected intercourse. We can offer testing here at the Health Hub for young men and young women who have been exposed to risk. For the young men, we can test for chlamydia and gonorrhea, as well as chlamydia and gonorrhea for the young women. For the young women to test for chlamydia and gonorrhea, we use a vaginal self-swab, which the young woman takes to the bathroom with her, swabs the internal vulva and puts it in a test tube like this sample here, which we have a bottle like this. For the young men, they do a urine sample and present it in a bottle like this, and then urine from this bottle is put into this sample bottle, which is then sent to the laboratory. At no time are the young person's name used on any sample bottles or sample forms. In fact, we use a special code regarding the Health Hub, and we also use the young person's initials. Ordinarily, it takes about 10 days to 14 days before results would come back to the Health Hub, and I would receive that in a letter form. And in agreement with the young person, we would then contact the young person with their results. Ordinarily, this would be via text message, and most times that is just a text message to say, "Hello, it's Kate from the Health Hub, all well," and that is discussed with the young person regarding spreading their results to them with consent. If a result comes back for chlamydia testing or gonorrhea testing which is positive, the young person is contacted by myself and asked to give me a ring to discuss the results. With their consent then, I would forward them to either the gum clinic, which is based in our locality, or to their GP for treatment. This treatment usually involves taking an antibiotic for a short time, and this then clears up the sexually transmitted infection. We know that in research, up to 2 out of 10 young people can have chlamydia or gonorrhea and are unaware of the signs or symptoms. In fact, 70% of young women may have chlamydia if they've had unprotected intercourse and don't show any signs or symptoms. The sad thing is that if a young woman does not get tested or have treatment for chlamydia or gonorrhea, she may well be infertile later on in years whenever she is trying to have a child, because it can cause pelvic inflammatory disease. Some of the signs and symptoms of chlamydia or gonorrhea are pain when passing urine, pain in the lower abdomen, unusual discharge from the vagina or from the penis, and anything that's unusual like that should always be followed up. We would encourage all young people to come forward for testing and have it done the same way as they would get their eyes tested or their teeth tested. It should be as normal as getting your eyesight and teeth checked every 6 months, particularly whenever a young person is changing partners frequently and not using any form of contraception, such as condoms. Keep safe.